Alrighty, folks, welcome to another edition of The Healthy Way right here on Love 101, the family station. Today we're talking about scoliosis, right? Now, it's an abnormal curving of the spine. The normal shape of a person's spine includes a curve at the top of the shoulder and a curve at the lower back. Now, if your spine is curved from side to side, you might have scoliosis. So that's our topic today. With us this morning is Dr. Alex Tracey. Hey, Dr. Tracey, how are you?
Hey, good morning. How are you?
I am good. I am good. What do you want to add to that?
Well, the thing is, scoliosis is a major medical issue that affects especially children. The thing with scoliosis is that the complications which comes with scoliosis is not only physical, but it can be something that is quite mental based on your appearance with others, and as such, it's a significant medical issue.
And then there are different types of scoliosis. Walk us through some of them.
Right. So there is we have to go along the line of knowing that majority of scoliosis cases are unknown. The cause is unknown, and that's called idiopathic scoliosis, right? But there are other causes of scoliosis, whether it be congenital, related to muscle, or if it could just be that you develop it during your adult stages of life. So those are the different types that you look at. So congenital, you're born with it. Like if it's due to some form of muscular or nerve issue, then that's another type, as well as whether or not you develop it during your adult stages of life. And as was explained, majority of cases of scoliosis falls under the umbrella of what's called idiopathic scoliosis, meaning the underlying cause is unknown.
So it's not easily identified. And so what causes the other percent? So what causes those?
You mean apart from the idiopathic?
Right.
So if you're looking along the line of congenital, there's certain things that can actually predispose a baby to be formed with congenital scoliosis. So if there isn't a normal formation of the spine during the development of the baby, that can lead to what's called a bone malformation. And the bone malformation will lead to, not all cases, but in some cases, a curve of the spine. Be aware that you have what's called kyphosis versus scoliosis. Scoliosis is the sideway curve of the spine. So you have to kind of notify that not all curvature of the spine means it's definitely classified as scoliosis. It's usually the curve to the side. Understand?
And so that's the S. That's the S shape or the C.
The S.
The S.
Right. Now, in terms of muscle and nerve, that's classified as like a neuromuscular kind of picture. So certain conditions can predispose you to a neuromuscular cause of scoliosis. A major one is Marfan syndrome, right? And there are some criteria that you'd have to actually tick off for the person to be classified as having Marfan. Persons who have cerebral palsy and muscle disorders, those persons can actually develop scoliosis as well. Right?
Yeah.
Now,
yeah, go ahead.
Now, one thing that we actually realized, especially with the idiopathic causes of scoliosis, is majority of it occurs during the adolescent stage of life and affects mostly females, right? The thing is, there is not an actual cause to say, hey, this is the reason why the person got this curvature. There isn't a predisposing factor, except maybe they had a family history of it, but there's no medical condition that is actually leading to them having the scoliosis. And that's why it's considered idiopathic or scoliosis of an unknown cause. Right?
Yeah. No, I was reading something on how it's diagnosed, and it says a physical exam of your spine is the first step your doctor takes to see if you have scoliosis. Now, your doctor may also order some imaging tests to get a closer look at the spine. Um, and they'll check for spine, curving and whether your shoulders and waist area are symmetrical. And then they'll ask you to bend forward, looking, for the curve in the upper and lower back. Walk us through the diagnosis, Dr. Tracey.
Right. So it's a combination of physical examination, imaging, right? An orthopedic surgeon and an experienced general practitioner can identify scoliosis on physical examination, right? Provided that the person is not actually in pain, because sometimes you can have what is called a pseudoscoliosis, a false scoliosis, because you're in pain. You actually modify your posture to facilitate comfort, and that can lead to you having a false scoliosis. But on examination, we may notice that one of your shoulder might be higher than another, right? Your hips as well. One side of your hip might be higher than another. Or you may actually be having the waist. One side of your waist actually looks more protruded than the next. So those are some of the things that we can pinpoint. But the orthopedic surgeon, using certain techniques, can see the degree of scoliosis, right? Based on an X-ray, right? And they can determine whether or not it is needing observation versus surgical treatment. So the whole management of it, and I know we're probably going to go into that a bit, is that it depends on the degree of severity, whether or not it's mild or severe.
Right. Well, let's go into the management. Yes, let's talk a little about that. Pain management. Let's talk about that.
Well, if you're looking at management, medication, painkillers would be necessary, right? But braces, they use a lot of braces to kind of hinder the progression of scoliosis.
Right.
You have to understand that the scoliosis, especially in the idiopathic cases, would progress or worsen as the child grows. So during that growth spurt, you want to actually prevent the scoliosis from getting worse. And one of the ways that they prevent that is by using braces, right? The next thing is surgery, and surgery is for like severe cases whereby they may actually try to align the spine with like rods and screws. And sometimes this can be quite a challenge, especially if it's a very severe case.
Right.
And it can be devastating to the child as well to be going through such a major surgery. So you don't only look at the management of the condition itself, but the whole mental toll that it may take on the child growing up, being told, hey, you don't look right. It can lead to depression, anxiety. So those are some of the things that you have to take in consideration as well.
Right. So would you consider it as a disability?
Well, it can lead to a disability, right? Especially in severe cases, you may actually be considered disabled, unable to walk properly, unable to do functions like a normal person would actually be able to carry out their tasks. So once it's affecting within your daily life and daily activities,
Mm-hmm.
it's considered
A
a
disability.
disability.
Yeah. All right, let's look at long term. What is the long term outcome for scoliosis?
Well, the thing is, it depends on the type. So if you're going to be looking at idiopathic
Mm-hmm.
cases of scoliosis, you can see where, yes, it will lead to the child having um, disability at some point if it's actually
Mm-hmm.
a severe case. But it can also lead to behavioral problems in terms of the way that they function in society, right?
Mm-hmm.
But looking at the other aspects of the body, it can affect your lungs, right? If it's a case that is a severe case, the lungs on the side that is actually curved inward
Mm-hmm.
can actually cause what is called crowding of the ribs, right?
Mm-hmm.
And the crowding of the ribs can actually impact the way that your lungs either expand or, inhale or exhale, the way that you inhale and exhale. So
Right.
it can affect the way that you breathe, right?
Mm-hmm.
And you may have what is called chronic back pain. So some persons, no matter what, because of the scoliosis, they end up with this constant back pain that they just can't get rid of. And you would be surprised to know that a good amount of persons that keep presenting because of back pain is because they have some level of scoliosis that was never actually discovered.
Mm-hmm. Mm-hmm.
And moving forward, they would need not only treatment in terms of medication, but they may need like a physiotherapist
Right,
to
right.
assist with the chronic back pain.
Mm-hmm.
And in severe cases, they may need to see a orthopedic surgeon.
Mm.
And the whole aspect of how you look, the way that you would have to wear certain types of clothing,
Right.
those are some of the things that you have to look at as well.
Mm. So, the important question, will it ever stop progressing?
Well, as I was actually explaining to you, for the idiopathic that normally affects the teenagers, right?
Mm-hmm.
It usually ends when they stop growing, right?
Mm-hmm.
But you have to look on the fact that you have additional causes of scoliosis.
Right.
It can be secondary to an underlying medical condition,
Mm-hmm.
right? Something wrong with the nerve, something wrong with the muscle. And if you don't treat that condition, then it can progress further,
Mm-hmm.
right?
Mm-hmm.
So those are some of the things that you have to consider whether or not it's on the case on the background of idiopathic
Mm-hmm.
versus it's secondary to an underlying medical condition. You'd have to treat the underlying medical condition to prevent it from progressing worse. In idiopathic cases, you have to actually assist in seizing the progression, right? So it will tend to progress unless you intervene.
Mm-hmm.
So that's the thing.
Great.
And then it will end the progression at the end of the growth for the child.
Great. Well, that's all the time we have today, regrettably. How can we find you again?
Okay, so my offices are located at Shop 128, Greater Portmore Shopping Center, and I'm also at 23 Young Street beside the Cumberland Farm.
Can I thank you? Keep up the good work. Appreciate it.
Okay, no problem. Take care.
Great. Dr. Alex Tracey there, here talking about scoliosis. Yeah, this is Love 101, the family station. Catch you again tomorrow at the same time for another interesting feature inside the Health Way. Please do stay with us, no? Yeah?